to WRPB and WRPB Studios. So you guys have been following me for a long time, know how important I think functional medicine is, and how I feel about the pharmaceutical industry just kind of pushing pills. Um, so it's important that I bring to you people that actually get to see both sides. With me is Alexandria, and you are a nurse practitioner?
Yes.
Okay. My first question is how long you been around the industry?
I've been in the medical field for 12 years.
Okay. It's interesting because when I talk to people before they get on the air, I ask them how long they've been around the industry, and I ask them why they got into it. And it's interesting that I would say 90% of people that get into an industry got into that industry because of either them or somebody close to them needed whatever they're doing. So why did you get into this industry?
Well, I got in the medical field initially because I just always wanted to help people. But why I got into functional medicine was my own personal struggle with my autoimmune condition. I was diagnosed with rheumatoid arthritis back in 2018.
Oh,
Yes, yes. And then initially, right away, I went the conventional route. I seen a rheumatologist. Right away, they wanted to start me on 3 medications. One of the medications I actually declined because it was considered a category X medication, which is basically it's not safe for women who are pregnant or nursing their child. So at that time I was engaged, so I knew that was not the medication that I wanted to be on because I want to have children in the future.
right.
Yes. And then that's when I started looking for other alternatives. I did start the other 2 medications, but I still wasn't pleased with how I was feeling. I was still experiencing a lot of joint pain, a lot of brain fog. And even after I eventually ended up getting pregnant, and even after giving birth to my son, I actually ended up having a really bad flare up. It was to the point where I couldn't even pick him up.
Wow.
I was in that much pain. And this is when I started to do research and started looking for alternatives because I realized the medication was not working for me because it was just putting a band-aid on the actual symptom and not actually treating the underlying root cause. So this is when I found functional medicine, and I seen a functional medicine practitioner, and right away she started a protocol. I started feeling better, and I'm like, why am I treating patients the conventional way, just putting a band-aid? I was like, I need to go ahead and start educating myself and being able to help people and really get them to true healing. And that's when I decided to actually get my certification in functional medicine and
What's the
start my own
difference
practice.
between functional medicine for us people who are stupid and regular medicine?
So the difference is with conventional medicine, pretty much the patient will come in and they have this list of criterias and symptoms and labs. And then once they fit that criteria, we're pretty much taught in school that we're just supposed to prescribe them this medication and just to help with the symptom. But opposed to functional medicine, we're actually looking at what is the actual root cause. So we're ordering advanced testing. We're getting very detailed medical history to actually see what is the dysfunction. Some patients come to find out it's heavy metal exposure. Some patient is mold exposure. They're in a moldy home or they're working in a place that has a lot of mold. And sometimes it could be even from Lyme disease. It can be even from COVID, which they're
Wow.
still battling the spike proteins and things like that. So once we find that out, I'm able to properly treat them. But oftentimes with conventional medicine, these advanced testing are not offered and they're not available. And it's not covered by insurance. So that's why sometimes it can be a little difficult for people to get access.
Well, this is how I look at that.
Hmm.
Someone will go out and spend $200 for dinner, but they won't spend $200 for their health.
You're absolutely right. So it is important to invest in your health
Of course.
because you will see the reward in the end. You're
So
right.
now you decide to go into this, and I've said it a million times with people. Did you have family support?
Oh, I had so much family support, and I still have family support. My husband is my number one supporter. My mom was my first patient. Honestly, my husband was my second patient. My father was my third. So I have so much family support. I think is once they seen how I got better,
Right.
also they honestly started to truly believe in this. And them seeing themselves getting better and seeing my patients time and time again getting better, like it's just the support is just continuous, and I'm just so grateful for it.
Okay, so without breaking HIPAA regulations, okay,
Yes, yes.
is a lot of patients that you talk to issue become inflammation?
Oh, yes, yes. Inflammation, I would say that is the number one driver of almost all conditions is inflammation. So my goal is with my functional medicine practice with all my clients is reversing inflammation and treating the underlying root cause. So inflammation is very important, and it's very important to work on reducing the inflammation and eliminating the inflammation.
Is it, so the question becomes, can you reduce it via natural stuff instead of pharmaceuticals?
Oh, yes, yes. When we go into natural stuff is there's so many things when we're talking about natural stuff. It's nutrition, it's even supplements, it's even we're even looking at what is actually causing the dysfunction, whether it's a gut microbiome imbalance because that patient been on antibiotics for many years, or they've been on antibiotics even as a child, they had multiple ear infections, things like that. So with that being said, I'm sorry.
That's okay.
I kind of forgot what the question was. Yeah, I felt like I was doing good, but now I
No,
forgot.
no, you're fine. So we were talking about inflammation,
Yes,
okay,
yes.
and is there ways that are not pharmaceutical
Yes,
to fix that?
yes, there's so many ways. There's so many ways. Like I said, we're going into nutrition. We're also looking at the root cause. You know, we want to give that body the proper environment to heal itself, like we've talked about earlier. So it's so important to just give your body the proper environment. So once we see what the root cause is, we're starting to target and treat that root cause. Then while we're doing that, we're also focusing on nutrition. We're focusing on implementing food that will be reducing inflammation. We're also giving you supplement recommendations such as turmeric, such as there's so many other recommendations. There's berberine, but it all depends on what is going on with that patient. So that's why it's so important for that patient to book a free consultation, and so we could get a very in-depth medical history so we could really hone in on what is the issue, and so we could work on reducing the inflammation.
Oh, I have to ask you this question.
Yes.
So my doctor says go get blood work. So I get blood work, and things come up because life gets in the way and stuff, and I don't get to him for 110 days. And he says, I can't use that blood work 90 days. Does that really make a difference?
Oh, yes, it does make a difference.
Does it?
It does.
I mean,
But there's still a lot we can do even with the blood work that was 90 days ago. But however, it does make a difference because there could be changes that you've been doing within the past 90 days, and we're not sure if that is actually reflecting in the blood work 90 days ago.
right.
So it's always good to get something as updated as possible, because like we spoke about earlier, you've done some dietary changes,
Right.
and you've seen some
Probably not
changes in
enough,
your
according to my wife.
I think you're doing well. You're doing well. You've lost some weight.
But what do you do with somebody like me who doesn't eat vegetables? Okay. Like I said in the other room, it used to be if it wasn't fried, it wasn't worth eating.
Yes.
Okay. So I already had that mindset for so many years. It's very hard to change old people like me. So what's the scenario there?
I think the scenario there is educating and also just meeting that patient where they are, just trying to see what do they like. I mean, there are a lot of other healthy foods that some people may not necessarily know how to, what would I say? There's a lot of tasty foods that people are just not aware of.
Okay.
So therefore, I just have to be able to open that patient's mind, open up your mind, and make you realize like, hey, there's so many foods to taste, and then we should be eating the rainbow. So if we focus on that, I'm sure there's so many things that you could implement into your diet that you didn't realize that you liked.
Hey, look,
Yes.
my wife's a chocolatier, so
But there
Dark chocolate is good.
Dark chocolate is good.
And I only eat dark chocolate.
Exactly. So you just want to avoid the artificial ingredients.
Yeah,
so what I tell people is read labels. Dark chocolate is good. And there's a lot of plant-based foods that actually are very tasty. I just think some people are just not aware that it is out there. So what I focus on is just educating that client and letting them know, like, there are so many local grocery stores that can pretty much help you through this, like while you're trying to figure out alternatives to healthier food options. Because trust me, it was difficult for me in the beginning too. Someone like me who loved Taco Bell so much, and I still love tacos, but I just found a healthier way, and actually I enjoy it more. There's so many options.
You know, it's funny because we have a mindset
Yes.
that really has to change.
Mm-hmm.
Because I like sweets, so
I
They
could
say-
second that.
they say try beets.
Yes.
But there's something in my head that says you're not gonna like that. You're not gonna like that. Now I love bananas.
Mm-hmm.
Okay, but bananas have other things that don't work for me.
Yes.
Which, if you have a kidney issue, bananas are really tough for you, on your kidneys.
Mm-hmm.
But how do you change one's mindset? Like, if I closed my eyes and you gave me a drink with beets, I probably would like it because it was sweet, right?
Mm-hmm.
But if I know it has beets, my mind says, no, you're not going to like it. So I think it's a psychological thing for some people.
It can be, but what we can't, and then I'm not trying to cheat anybody into eating healthy. So what I focus on, like I said, is just educating them and letting them know that there are healthier options that taste good.
Okay, so
Yeah.
I decide I want to make a change in my life.
Mm-hmm.
So I go to your website or I call you, whatever, and you set up a free consultation.
Yes, a free consultation.
What do I need to be prepared for in that consultation?
So what you need to be prepared for is, what are your goals? What is your goal?
Stay alive. Can you
Stay
help me there?
alive. And then you also want to focus on reversing inflammation,
Okay.
right?
How do I know if that's my issue, but
How do you know if that's your issue?
Yeah.
I mean, you got to take a deep look and see, do you want to focus on having a better quality of life? Are you struggling with joint pain? Are you struggling with brain fog? And do you want to start focusing on getting that resolved? So,
I'm going to have this consultation with you.
mhm.
And that's going to give you some basic information, I guess. Because I'm going to guess from talking to you that you can pull a lot of information from blood work.
I could pull a lot of information from blood work, but honestly, a lot of information also comes from the medical intake. So after the 15-minute free consultation, we decide if we want to move forward with the program. And then now the very first visit is 1 hour long. So this is where I get a very detailed medical history. I even ask you, how did you even come into this world? Was it vaginal delivery or was it cesarean section? Were you on a lot of antibiotics as a child? Did you have cavities before as a child, and were they filled in? If they were filled in, were they removed? Were they replaced? The reason why we ask all of this is because we want to know what is the possible toxic exposures that you can be battling at this moment. So, and then that's how I'm able to craft a plan, a program, and also suggest some additional testing that would be needed so we could see what the root cause is.
Are you going to send a requisition for blood work at some point in time?
Yes, I will. But like I said, it all depends on the medical history of that patient and what are their actual concerns. That's the way I'm able to provide individualized care. So I can't say like it's these standard labs because every patient is treated as an individual. So it's based off of the information that I'm getting from that patient. So it's one-to-one. And it's not standardized, it's individualized. So I can't really tell you exactly what lab I would order.
That's interesting because I get that. Because
Yes.
even here, when people say, I want to do my own show or I want to do a podcast, can you give me a price? And I usually can't give them a
The
price
price.
because I want to know what their industry is and the best way. Because every industry is a snowflake, and the way to market that industry is different.
Exactly.
Okay, so you can't say, hey, it's $700 because $700 for a bagel bakery might not get me the things I need to help
Exactly.
that. And I guess it's the same for that philosophy, is that you want to make sure that you get the blood work you need, and stuff you don't need, you're not going to really care about.
Exactly, because everybody's medical history is different.
When someone calls you after their first consultation, not after their first visit with you,
Yes.
okay, is it like a regular doctor, meaning, hey, this is what we found, this is the protocol, this is what you should do, and then we'll set up another appointment 6 months from now, 3 months from now?
No, no, no. So typically my programs are 6 month long, and I'm seeing that patient every 2 weeks. So I'm checking in. I'm also creating a protocol initially, and sometimes even changing that protocol even after a couple of weeks. Because if that patient is telling me, hey, this is not working for me, hey, I'm having a difficult time. So that's when I go ahead and start to think about other alternatives, other ways we can work on what is their current issue at this moment. And then what my program, it entails actually about 10 visits for 6 months, and as well as the patient is able to text me and message me from 9 to 5 Monday through Friday. So I'm available pretty much 5 days out the week for them as well, for any type of additional support that they may need.
Interesting. We're getting to the top of our time. How do people find you? You have a website?
Yes, I have a website. The website is elitefunctionalmedsolutions.com.
And they can find you on Instagram as what?
Yes, alexandria.elitefunctionalmed.
Okay. Before I let you go, just quickly tell me what certifications and stuff that you have.
Okay.
Do we have enough time?
Yes,
Go
we
ahead.
have enough time. So I've been in the medical field for 12 years. Initially, I was a registered nurse. I went back to school in 2018, and that's when I obtained my master's degree at the University of Miami to become a nurse practitioner. So I've been practicing as a nurse practitioner for 7 years. Initially, I was actually in the field of nephrology.
Wow.
Yes, so I dealt with patients that were diagnosed with end-stage renal disease, on dialysis, acute kidney injury, chronic kidney disease. And then even sometime I still help that current practice. I actually work with them once every 2 months. I cover a weekend for them at the hospital. So I'm still in the conventional space, and I'm still aware of what's going on. And then currently, about a year ago, I actually obtained my functional medicine certification. And I've been in the functional medicine space, I would say fully, for about 4 years, but I obtained my certification about 1 year ago.
Everybody. So, you know me a long time, and you guys know that I had some kidney issues, but my wife had passed away from kidney failure. She actually had 3 kidney transplants. So, kidneys are so important. I mean, your whole body is important to take care of.
It is.
But, and correct me if I'm wrong, but being given all these pills, it takes a toll on your kidneys, on your liver.
It does.
Okay, and I think that's why functional medicine is really a better answer to, if nothing else, to start with. And my philosophy has always been, our bodies are meant to heal themselves. Sometimes we need a kickstart. That's just the way life is. But if you go into all these pills and stuff, you're not solving one problem. You're band-aiding one problem.
And then creating
and
another.
And creating another.
Exactly.
Everybody, check her out. Everybody will have a great day. We'll be right back.
All right. Bye, everyone. Thank you.